If you want to know, you have a athlete who needs an MRI and you want to know what to do and how to inform the patient, you need to tune into this episode. Before I go on to the podcast, what is new? What is better in life? I have to celebrate those who were at my strength and conditioning summit over the weekend. It was amazing. I hope you guys all enjoyed it. I hosted 5 different states and 2 countries. Truly amazing. And Petros from Greece, it was great to have you on there. Excited to help you in your journey in physical therapy. What else is happening? My son Jacob just turned 2 over the weekend, and gosh, he is growing up so fast, and it's amazing to watch him turn into a little boy, but then also the challenge with him being more independent and wanting to do things on his own is also slowing us down just a little bit. My son Zach is doing fantastic. He's loving jujitsu, but the fun fact is, we just added my daughter into jujitsu, and I'm excited for her. I have to be careful not to push her too hard, let her kind of simmer into it, and I think she's going to do fantastic. Other than that, my wife and I are doing fantastic, enjoying life, every busy minute of it. All right, on to this podcast. Why am I doing this? This is a conversation I had with a physical therapist I mentor about, how to, what if you feel like somebody needs an MRI? And I'll tell you about some interesting cases I've had in my career, and the cases that I've mentored other people on, and they've told me them, and giving you feedback on how you should approach this in your clinical practice. But the question became, hey, someone I'm treating would benefit from an MRI, and what would you do? What wouldn't you do? And then how do you deliver that without, within the being in the purview of your state, laws and your practice act? How do you tactfully, professionally, ethically deliver the message? Without scaring the patient, and giving them an opportunity to make that decision. I think you have to really consider that, today's patient is more informed than ever, and they've done the Googling, they've done the YouTube, and how do you deliver a message that if you say, hey, you mentioned the words MRI, people are like, oh my gosh, do I need surgery, right? So that can easily jump forward. And the discussion came about of, what steps would you take? How do you follow up with them and ensure that they're on the right path without pushing them one direction too far and scaring them and setting them down this rabbit hole, right? So it was a great conversation. I wanted to share it with you because I'm sure a lot of you out there are having this same challenge of, whatever, if you're working in a hospital or you work in a cash-based setting or insurance-based or in pro sports, we all have this dilemma, this challenge on how to do it. And I've probably had this conversation thousands of times with athletes and in under different scopes. And I wanted to share how I've been able to put that into a couple of simple phrases, and it can help you in your practice, whatever setting you're in, to ensure that that you're successful and you can help people. That's really what it comes down to. So let's get it started. Okay, so what do you do? How do you how do you start the conversation, right? So let's talk about somebody, a basic case, right? Like a knee meniscus, right? Whether before you start talking about an MRI, I want to phrase I want to phrase a question to you of, if you knew something was torn or not, how does that change your plan of care? How does it change your plan of attack? So if you knew a meniscus was torn, what does that change in the clinic? What does that change for your exercise routine? What does it change about anything? So let's take a case. Let's take a non-operative, 2-week-old knee injury that comes in the clinic, and they have clicking, sharp pain with squatting, terminal knee extension doesn't feel good, and a little bit of swelling. And they see you first. There was direct access, and they see you first. What do you do? Most physical therapists that I've seen will say, oh, we should really get an MRI on this just to be sure. Then the patient says, well, like, do I need surgery? They start Googling all these things. And just by you mentioning that now puts their mindset into one direction, right? The minute you say that, you watch their face and they're like scared, right? Now, all you did was said MRI, and what you didn't do was preface with anything. And when you go MRI, they think surgery. And now you set them down a path of, oh my goodness. Before we change that, and I give you my recommendation is, if you knew that it was torn, how would that have changed that initial valuation? And even if you did your special test and you're like, wow, it's definitely pretty close to being, an irritated meniscus. Now, there's plenty of studies to show the amount of um, non-painful meniscus tears that are out there with positive MRIs. And so you kind of have to put that into your frame of reference now. Okay, so a large portion of people who have no knee pain have meniscus tears. Now, knowing that there is a meniscus tear, how do you know if that was the thing that was causing them pain? And now that you know what it is, what would you have changed? And for most of us, you question that. You're like, well, I guess I don't know. I mean, what would I change? I would just change my depth. I would tell them not to run for a little while. I would um, work soft tissue. I would tape. I would uh, dry needle. I would do all these things. Okay, great. So why don't you just do that? And why'd you push them down MRI and fear, create that sense of fear and urgency? And if you can understand that you can still work through your plan of care and your treatment while you do the MRI. Now, most of us might be saying, well, that's what I meant. Well, that's what I would do. Oh, I see. So before you tack on MRI into your verbiage, there's a lot of words and a lot of phrases that need to be said before you start discussing that. That's my whole point. And as physical therapists, we don't see it from the patient side. The amount of athletes that I've messed up, the amount of athletes that I've flared up, the amount of athletes that I have informed too soon that created anxiety, fear before an event, after an event has been significant. And I can't have that happen to you. And you're probably doing it right now and you don't even know it. So I want to bring this to your attention because you have to put it into your toolbox. And after delivering the course this weekend of the Strength and Conditioning Summit, I'll talk to you guys more about that because it was incredible just to get the feedback and see where clinicians are. And there are some studs around the country. Those who were in the class, I'm very impressed. You guys were, I mean, you get it, and I'm excited to see your growth over the next year. So, what happens when you have something you're familiar or not familiar with? The gap that I see with a lot of clinicians is the communication. The client or the athlete knows what they want and they need some information to get there. The physical therapist knows exactly what they need to get to that time point. But the gap between the clinician and the patient is a way of communicating it. So a couple examples that we talked about were, okay, so if a patient's hurt and they have to compete in 4 weeks, um, what would you say to them? And a couple therapists were like, well, you won't be able to. Wait a minute, wait a minute. There's a big gap inside that sentence. One, it just completely tore down all aspirations and hope. What if this was the thing of their life? They wanted to one time run a marathon in their life and they don't want to do it all over again. You're really going to say, just don't, it's not even possible? No, 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 no. Your ability to communicate your different options and what options they have to do that is where physical therapists like we lack, where we have this fear of being judged. We don't want to be wrong. We don't know what to say. We don't know how to say it. And so when you're talking about an MRI, it's the same thing. I'm going to give you a couple examples here. You ready? The next time you have somebody who wants to that you highly recommend that they need an MRI, how do you say it? You don't say you need an MRI. There's a lot of layers. The way you open this, and I'm going to outline step by step. Mr. Jones, you came in here wanting to know what to do about this knee pain that started 2 weeks ago. It's been limiting you with walking. You're having trouble going up and down stairs. After going through the evaluation, everything we covered, yes, you do have uh, weak hips. We can get your knee stronger. We can definitely get your ankle more flexible and improve your balance. All of those things will make that knee better. Now, as you mentioned, you do have some swelling and you do have pain with going down, up and down into a squatting format. What we're going to do is address all of those things over the next 4 weeks. For the first 2 weeks, we'll work on your range of motion, your flexibility. The last 2 weeks, we're going to work on your strength, your balance, and getting you back to squatting with less discomfort. Along that timeline, you might have ebbs and flow of improvement. If you're not improving at the rate that we expect, I would highly recommend seeking additional support or education from your primary care physician if we need an MRI in the future. So how is that different than I really think you need an MRI? What I just did there is I helped the person understand that regardless of what it is, I would have a plan of care. If they need an MRI, I didn't say you need one. If things aren't going on track, we're going to start the path to kickstart that. Now, you and I know that it's going to take, gosh, maybe a month inside a medical system. And if you're really fearful, right, that's for somebody you're like, I think they're going to need it down the line, but you don't want to scare them. So if you're fearful that this person needs it and it impacts their life and they need it right now, then you verbalize this a little differently. Mr. Jones, we went over all the knee things that you talked about. You're concerned about this. You're fearful that this is something very serious. I agree that there are some components in there that do look like it is flared up and you're having some issues. I can't confirm whether it's torn or not. I don't have x-ray vision. But what I can tell you, over the next 2 weeks, we're going to work on these things. Now, if you feel that this is in your best interest to do an MRI, I would be in favor of that too. However, during that time, it's going to take you 2 to 4 weeks to get into your primary care and then into your surgeon. The great news is I'm going to work with you during that time while you get in, so that way we can manage your pain, reduce the risk of flare-ups, and ensure that you're strong as possible. So by the time you get that results, you can then figure out what you want to do. Because here's the next question. Say they do have a positive MRI for a meniscus tear. How is that going to change your plan of care? You ready for this? And how is that going to change the patient's mindset about what they want to do about it? And that's a great conversation to have on the initial evaluation or a follow-up visit. So as we talked about last time, so this is probably at a time where you're like working on their knee, like they're calm, they're under good conditions, they're relaxed. Hey, Mr. Jones, I know we talked about an MRI. Just so I can understand, if it was torn, you have a couple options. You leave it alone, you work on rehab with me, or you have surgery. If you did know what they were, like what would you do? Which path would you choose? Which option would you go with? They're going to be like, oh, I don't want surgery. Oh, that's fantastic. So you would do nothing about it or rehab. But judging by you're coming here, you probably want rehab. Yeah, absolutely. So even if the MRI was positive for a meniscus tear, you'd still be doing the same thing with me. Is that correct? Yes. So then why would you need the MRI if the course of care is exactly the same. Well, I just want to know if it's going to get worse or not. Oh, then I completely respect that. Absolutely. So over the next 4 weeks, while you wait for rehab, let's just manage it. What I've seen a lot of physical therapists do is they don't do a lot of the prefacing. They don't do a lot of the work on the front end. And they go through the evaluation and they're like, yeah, it does look torn. I think you're going to need an MRI. Without the understanding of if it was torn, how would that change anything for you as a clinician and the patient? It would do nothing. So why did you say that? Why did you bring it out so that they can get scared and you lose all credibility? That is not your job. Your job is to help people with their quality of life and then get back to everything that they love doing in life. Now, what you just did there was the opposite. And we don't see it as that. We're just being truthful and honest. You know what? You can still be honest and truthful, but give them the reassurance that you are going to help them. The minute that you didn't add the prefacing on the front end and you said MRI, you think you need surgery, anything that you say after that is like digging yourself in a hole. I mean, you like, no, don't worry. You're not going to need like that big of a surgery. Don't worry. And we can rehab it. It's almost like you're begging for forgiveness. You're like, oh my goodness, I said something I shouldn't have. And the reason you know that is because your eyebrows went up. Anytime that I'm working with somebody and I'm about to layer on something pretty serious, I'm going to watch your eyebrows. I'm going to watch your hands, and I'm just going to watch them and process how they're taking in this information. And sometimes as physical therapists, you know what you do? You forget all about that. And I'm going to here to treat a region. You asked me for it. I delivered on it. No, I'm here to help you get from point A to point B. Along that journey, there's going to be a lot of hiccups, but I'm here nonetheless in your best interest. And as a physical therapist, you forget about the human side. You forget on the delivery of the message. Most people are like, well, how do you say it? It's all about front loading the conversation and understanding, first and foremost, what would it change for you? Think about that. Nothing. We're over that. Great. So now we have 4 weeks to get this person out of pain. Now, what does it mean to them? Now, if they say, I want to get surgery fast, then absolutely. In the meantime, I'm still going to see you a couple times a week, even if you get in surgery 2 weeks from now. I'd still love to do because we know that preoperatively, the stronger you go in, the stronger you come out. So might as well see me. So what's the outcome if this MRI is positive or negative? You're still going to come to see me. But it's not what you say, it's how you say it. And some of us who, treat 5, 6 people an hour, maybe you don't have time for that. But you're about to change somebody's perspective about what the next 6 months to a year of their life mean. You better believe you need to take a step back. You as a clinician need to be reminded of what implications and impact you have on people. Now, there's been many times where I've messed up on this, right? I did what I'm telling you. And the more physical therapists that I mentor, the more clear it gets. The more I'm like, oh my goodness, we're just destroying these people's hopes. Do not do this. And you might be like, well, I don't really do that. Yes, you do. You might think that you're saying the right thing. All you're using is physical therapy, medical terminology that doesn't resonate people, and they can't understand what you're saying. Why? Because you work in a setting that promotes medical terminology, and all you have to remember is, can this be, whatever you say, whatever you spill out of that PT jargon, can that be understood by my son, Zach, who is 6 years old? Would my 6-year-old son understand that? Would your 70-year-old grandma understand that? So if you're here with like, oh, the medial portion of your meniscus, see how it's a buckle handle tear, and every time that you go into terminal knee extension, my son would be looking at you like, what does that mean? Simplify it. There's a little bit of swelling. There are some tests in there that tell me there might be a little bit of damage inside that knee. So what we're going to do is we're going to get you out of pain. We'll get you more flexible, and we're going to tell your doctor to move forward with that process. How do you feel about that, Mr. Jones? Super simple. Make it easy within 15 seconds. And if somebody didn't understand English, could you deliver that? And sometimes you just have to deliver on the one thing that makes sense. This has a little bit of irritation, and it might require some extra help with imaging. We're going to continue therapy to make you feel better. In the meantime, how does that sound to you? Take that phrase and stick with it. No more, well, your calf looks a little restricted from the medial portion, and your heel's a little locked up with medial inversion and eversion, and you actually your posterior capsule of the hip is actually really stiff. You cannot use posterior to any single consumer anymore. Don't say posterior. Why are we talking about a capsule? Your shoulder is stiff. Your hip is stiff. Sounds good. And if you can convey that, the easier and better your communication gets with the people you serve, the less harm it creates. And now you might say, well, I don't feel like I do any harm. Yeah, but you can do more good. You can help people understand that. I was having a conversation with a physical therapist today. At the end of an initial evaluation, every patient will go home to their spouse, family member, whatever it is, right? And the spouse, family member will say, you went to therapy. What'd they say? Every evaluation, I focus on one thing. The what did they tell you question. Meaning everything inside 1 hour of an evaluation, or 30 minutes or 45, whatever your structure is, can be defined by one sentence. And that one sentence is the thing I focus on every single patient. Why? Because they're going to go tell their spouse. It's the thing they can walk away with off of this podcast. Keep it simple in under 15 seconds so that my son can remember it. That's the one thing I want you to walk away with. Do not say you need an MRI. You need to say, we're going to work on this and get it pain-free, or as much close to pain-free as possible, while you wait for the results. That's it. But if you say, we need an MRI, they get scared. You then say, don't worry, we're going to rehab it. They're going to go home and say, I need an MRI. What you just did there was put yourself in a hole. Whether if it's within your state practice, it doesn't matter. It's irrelevant, because that person just heard that they need an MRI. They're going to go to their surgeon, their primary care, their spouse. My physical therapist said I need an MRI. Whoa, it's not what I meant. Doesn't matter. It's not what you said. It's how you say it. So take that with you. It's a very critical piece. I probably get this conversation once a month. And physical therapists, in truth, you have this challenge because you're scared to say it. You're fearful of being wrong, and you don't know how to say it. So I'm telling you how to phrase it. My 6-year-old son should understand it. Should be the inside 15 seconds, and you should always think about what did they tell you question. At that point, you now understand what's the one thing they have to come across it. Now, when do you say it? It's after you've put together the whole evaluation. It's at the very end. Do not throw it in your objective. When you're doing a McMurray's test, whenever you're testing that thing, it's not the time to say it. Why? Because you have to put the whole case together. The minute you say it on your objective testing, you're ruined. It's over, because now have 30 minutes to marinate on it, or 20 minutes to marinate on it. Your job is to figure out, how does this fit inside their whole thing? Maybe during the evaluation, yeah, if this was something pretty serious, what would your goals be? Would you want to have surgery? What would you want? Get an idea of what their format and where their framing is, so that way you can make sure that you deliver your message is in line with what they need and want, and how that works together. The minute you can put that together, you now have success inside your delivery of your message. So, physical therapist, you're scared to say it. You don't want to be wrong. I just explained to you how to phrase it, when to say it. And then here's the other one. Who do you team up with? I mean, do you have a surgeon or a local primary care that you can partner with, that they would be open to having a two-way street? Like, hey, listen, this might be a little something major. Do you mind if I send you some people? No primary care surgeon is going to be like, no, we don't want more people. We definitely don't want to help any more people. We're tapped out. We don't want those people. And so if you can understand that, and you as a physical therapist, you might have surgeons or orthos or primary cares who maybe they don't want to respond that way. I'm the dictator, you listen to me, and that's fine. It doesn't matter to me. It's no skin off my back. I'm just trying to help humans. And if they can understand and feel your passion, listen, I have some people that, may or may not have some more serious things. Can I refer them to your way? I don't want to misdiagnose them. I don't want to push them in the wrong direction and waste their time. Do you mind if I send them to you? And that's the way you're going to phrase it. It doesn't harm anybody. It gives them an opportunity to process and, like, wow, that's actually, yeah, no, that'd be great if we team up together. And that's the way I would say it. It's like, hey, who can I partner with? Who can I team up with? So I just shared how to phrase it, when to say it, who to team up with. Now, once you've done that, there is an art how and when to follow up with that patient, because now they just went through this cascade of emotions that they weren't ready for, maybe. You've told them it after the summary of your entire evaluation. You then partnered with somebody to then say, hey, can we refer them your way? Now, what do you do on the follow-up? How and how often, and how do you make it so that you're not like scared of like that you misspoke or you're concerned about them? On the evaluation, I'll say, hey, I know we're going to meet next week or in 2 weeks, whatever the plan is. I'm going to follow up with you with email. Keep me posted on what your doctor or ortho says. It's no urgency. I just care about you and I want to make sure that you are all taken care of. Here's my business card with my email on it. Go ahead and send me an email, and I look forward to hearing from you and then also seeing you in a week or two. What questions do you have? And that allows them to be like, wow, that person staying connected to me. They don't seem like it's too urgent. They put me on a path and, in communication with the doc. So what I did was I made him feel good. I gave him a path. I gave him a connection, and I told him how to stay connected to me. That person is no longer scared. They now have full certainty that I know what I'm doing and that they're in the right hands. Contrast that with, you need an MRI. What just happened? You ruined them. Well, no wonder why people don't come back to see you. You just made a mistake. So, how to say it, when to say it, who to team up with, how and when to follow up. And the last thing I can leave you with is, you have to learn from these cases. Everything that you do and say is very, very critical. Most clinicians, they focus on like how they treat and what they treat. One of the things that can get you to spin your head around is, instead of focusing on like what you're treating and exactly how you're doing it, the thing that you can maximize your time in is how did you deliver that message? How compliant were they? And what was your progress based on all those things? And the reason why that's so important is because clinicians have a skill and the patient has an outcome they want to achieve. The gap between your skill and their outcome is how well can you convey it and how well can you keep track of it. Most clinicians work on deliver like they rely on their hands and their eyes to create outcomes, and you're assuming that knee valgus and the exercises that you gave them are going to deliver on the outcome. What you failed to do was communicate how you're going to follow up with them, what to expect, exactly what that means for them. The exercise is not the magic. It's the exercise combined with, during your running mechanics, I want you to alter this. In the event that you have some flare-ups, here's what I want you to do. You have green, yellow, red lights. Here's what I don't want you doing. Here's the things I do want you to do. And if we don't have any, if we have continued issues at week 6, we're gonna, refer you out to your physician in the event this is something more major, given that you want to go race in 12 weeks or whatever that number is. And by the way, you're also doing this glute exercise. When you put an entire case together, it's beautiful and you have significantly better outcomes. So the next time that you have an MRI that you are considering, take a deep breath in. Make sure that you're going to layer this recommendation, and you're not saying you need one, that you would recommend some, and you need to figure out, what would this mean for them? Are they going to have surgery or not? What does that change for your plan of care? Layer on exactly all of their objective measures, their impairments, followed up with your objective testing. Based on this, we can manage this. Depending on how aggressive or conservative you want to be, we can go down this route, rehab for 6 to 8 weeks, or we can go rehab to 6 to 8 weeks and start the process for an MRI. Which one would you want? And in the interim, I'll connect you with somebody. I'll follow up with you and make sure that you're successful. But nonetheless, you're still going to see me. And when you do that, you don't scare people, you maximize outcomes, and it gives you an opportunity to continually work on the things that you are good at, which is helping people achieve an outcome over time, helping them during a path that are going to have a lot of ups and downs. And as physical therapists, we work towards pain free. Pain free is going to be a problem you will always have, because if you can't layer this on, people don't continue to go see physical therapists who don't give them a concise, confident plan that they feel that that person solves their problem. Knee pain is not the problem. It's how they got knee pain and what they're going to do once they're out of knee pain. What's even when they're out of knee pain, you still have to fix mechanics. You still have to fix their training cycles, their form, and everything else. So knee pain is only the entrance into what you're about to do for them. So all you have to know is, in the event that you do have these issues, what does that change for you as a patient? And I think a lot of you are scared to have that. You're hesitant to, because you don't know what to say afterwards. What if they say they want surgery? Let them process that. I don't think they've even realized that they would do that. That's a better question. Now it changes their ability to process on their own, create independence with them. They can now process, wow, I'm an advocate for my own health. Yeah. What would you do? Let them marinate on that. On second, third session, bring them back. Did you consider that? What would you do? No, I don't want it. Great. So you're all in with therapy? Oh yeah. Now you just have commitment. Just be real. Have a good conversation with them, and that'll maximize your outcomes. What do you think about that? Yeah, so those were good conversations I've had recently over the last week. I want to share with you. It's everything I've covered inside the Strength and Conditioning Summit too. We were talking about return to sport. You know, how do you feel comfortable telling them, you know, this is a plan? And a lot of physical therapists were so hesitant. Why? Because we've been right a large portion of our life, because you're relying on grades, everything that was predictable. It's black and white. Now you have humans, and you can't project and forecast. Is it going to be doing? Is it going to be wrong or not? So you know what we do? Instead of saying, yeah, I'm pretty confident this is not it, you then say, let's not talk about it. Just come back next week and let's see how you're doing. Let me reassess next week. That's just your fear, your insecurity with being wrong. That's what, like, perfectionists are, right? We're very analytical perfectionists. We're fearful of being wrong, judged, and you have to overcome that, because it's not in the patient's best interest, most importantly. And you grow as a clinician, as a professional, by challenge yourself to, you know, challenge your internal, like, your judgment of, is this gonna take 4 weeks or 6 weeks, and actually put a number, put a forecast on when you would seek out additional help if this didn't go right. Now that puts you in a position where you're actually growing as a professional and not doing the same thing day in and day out. And I hope you're not in that position. All right. So that's the podcast. I wanted to give you that, more tools in your toolbox. A huge shout out to everyone who was in the summit over the weekend. Really want to give you just incredible applause for everything that you guys did. We started out with programming, went all the way through. And some of you asked about my academy. For those who've been asking, there's been a lot of people from the podcast and from my courses who've interested. Over the last 3 months, I've developed my mentorship groups and my academy. It's called the Sports PT Academy. It's a small group format, and we meet monthly, and we go over cases. This is tailored to whatever you need. Yeah, it's your time to review, like, your skills in strength conditioning, sports rehab, acute injury management, communication, MRI questions. These are all where I get all my questions. And if you want to have that one-on-one time in a very, very small group setting where there's other clinicians just like you who are running through the same problems, they work in the same environments, they're going through that same process, they don't know what to do with these cases. Where do I get stuck? What do I do? What do I do at week 10? Should I put my ACL into play? What do I do? And if you're looking for a community of people who are looking to grow, and they're okay with you know, being vulnerable, working through cases, and not being the let's see how it goes PT, or I'll figure it out on my own. That eventually gets to a certain point, and if you're looking for something more, you're like, I just need I just need a soundboard to work through some cases. If that's what you're looking for, that's definitely where you need to be onto your next step with your career into my academy. So if you're interested in that, send me an email, drchris@drchrisgarcia.com. I'm going to open up more seats, and I'd love to have you guys in there. I have the original group that has started with us, and they're growing. They've got a good base, and now we're going to start adding more people into the group. And I'm really excited about it because it fosters more discussions, more exercise progressions, templates. Everyone shares, and it's a great community where you can just be yourself and not be afraid to be judged. It's an opportunity for you to grow. More importantly, monthly, every single month. I've been in mentorships groups. I've been mentored my entire career, and I know what that feels like. And I'm just giving that back to the community of sports PTs or those who want to be a sports PT and work with more athletes. So if that's of interest to you, send me an email, reply to any form of my contacts, my Instagram, drchris@drchrisgarcia.com. Nonetheless, I hope you guys are developing professionally, and I will see you guys on the next episode. All right, take care. See you.